So the question was, what is uveal melanoma? I think probably best to explain that is if we were to understand what is the uvea. And so to explain that, you have to imagine that the eye is like a football or a soccer ball, with the white of the eye being the outside of the ball, and then you have two inner layers. The most inner layer is the retina, and that middle layer is the uvea. And it's from the uvea that the uveal melanomas arise. And so these are malignant or cancers arising in the eye. They typically occur in adults. And whilst we can treat the primary or the ocular tumor very well, unfortunately, approximately half of the patients who have uveal melanoma develop disease outside the eye. And typically, this metastatic disease, as it's called, occurs in the liver. And at present, we can't treat metastatic uveal melanoma in the liver very well. And unfortunately, the patients tend to die of this disease. So this is the aim of Cure 2020, is bringing together experts, clinicians, scientists, and looking at new methodologies, new techniques, new models, and we're trying to target or come up with new targets for which we can then treat the patients with metastatic uveal melanoma. I think it's important for people to understand that this type of cancer is quite unique in that it is completely different to skin melanoma or skin cancer. It has different biology and it has a different clinical course. So therefore it requires different treatment, targeted treatment, and with that we're trying to improve the prognosis of patients with metastatic uveal melanoma. The question was, what is uveal melanoma? So I think it's probably best if we start at with the basics and describe what is the uvea. And to understand that, it's best to imagine the eye being similar to a football, with the white of the eye being the outside of the football, and inside that you have two other layers. The innermost layer is the retina, and between the retina and the outside, or the white of the eye, is the uvea. And this is a very vascular layer. It has lots of blood supply. And so uveal melanomas are derived from the uveal tract. And these tumors are rare. They typically occur in adults, and they are treated, the primary eye tumor is treated very well, either through a combination of surgery or radiotherapy. Unfortunately, however, approximately half of these patients develop disease outside the eye. The tumor cells spread into the bloodstream and they go to the liver. And we are not good at treating this metastatic uveal melanoma, as it's called. And the idea of the Cure 2020 project is pulling together the expertise of clinicians, of scientists, and of pathologists, radiologists, all coming together using different methods, technologies, and models to come up with targets on these tumor cells so that we can treat this metastatic disease in a better way to improve the prognosis of the patients who, unfortunately at the moment, tend to die of this disease. So it's important also to realize that uveal melanoma is completely different to skin melanoma. So most people have heard of skin melanoma, which is a type of skin cancer. But uveal melanoma is a completely different cousin, and it has different genetics and different targets. And so what we're trying to identify are these new targets so that we can improve the overall survival of these patients.